Hello.
Okay, so can you tell something about yourself?
Yes, madam. My name is Maria Fe, 34 years old, single. I live in Barangay Linambasan, Hamindan, Capiz, Philippines. I have one daughter, 10 years old of age, girl. I finished my study in college as a nursing aide.
So you finished nursing aid. How long is the course?
1 year, madam.
1 year. Did you work as a nurse, an aide in the Philippines or no?
Madam, just now, ma'am, I work. I'm here in a work.
You are now working. Where are you working?
At the Mambusaw District Hospital, madam.
What is,
Capiz.
okay, so, how long you work there?
Since before I come in Hong Kong, I have working in uh, since 2006 to 2011, and then I go work in Hong Kong as a domestic helper since 2011 to 2012 to 2014.
Okay, so, okay, let's talk about your experience in the Philippines. So you work since 2006 to 2011 in the Philippines, working in the hospital, right?
Um,
So what is your duty in the hospital?
I'm working as a nursing aide. I'm to take care of the patients, taking the vital signs, and help the patients to assess them to what they're feeling well. If I mean rather, if they are not feeling well, or if what needs to take them.
Okay, so you also help them to sit in the wheel, push them in the wheelchair?
No, because they are a boy to post them, or I took handle to push the wheelchair.
So you also, do you also help the patient in changing the bed position?
Yes, madam. Yes.
Okay, so you also assist them in, is those who cannot eat by themselves, so you assist them in feeding, right?
Yes, madam. Yes.
Okay, so after that one, you worked there for 5 years. So after working there, you went to go, you came to work in Hong Kong, right? What
Yes,
what
madam.
year? What year you started to work in Hong Kong?
I'm starting work in Hong Kong in 2012 to 2014.
So you work for 2 years. You
Yes.
finished the contract, right? Where in Hong Kong is your employer?
In new territories,
A specific place, where in new territories?
Ocean, Sunshine City.
Mount Shan. Okay. And did you take care of kids there?
Yes, madam.
How many kids?
One,
How old are the kid when you started to work there?
1 year and 18 months,
One
girl.
year, 1 year, 8 months.
Yes.
Okay. Any grandma in the house?
Uh, no, but the grandma and the grandpa and the auntie, or the yes, they always come in my
In your
employer
employer's house. Is it every day or
every
every
day,
weekend? Every day.
every day.
So the
Yes,
elderly, but at night they don't sleep there. They only go there daytime. So how old are the elder? How old are grandma and grandpa? How old are they?
I'm not sure, ma'am, because I don't know, but I think they are 60
60s,
to
70s,
70. Oh, yes,
60s, in their 60s.
yes,
Okay,
madam.
the grandma and the grandpa can speak in English or no?
Only the grandpa and the auntie, but the
Can
popo, no,
Okay. So you also cook food for them, right?
madam.
So you go, are you the one to go to market or the grandma and the grandpa?
I am.
You are the one to go to market. Okay, so you finished the contract. Then why is the reason why you did not renew the contract?
Uh, uh, I have an important matter to fix here in the Philippines at the time, madam. So
You go back.
I, yes,
You
the important,
decided not to renew the contract. Go home for family matters, right?
yes, ma'am.
And after 2014, where did you go? After you go back to Philippines, what did you do? Since then, you'd never go back to Hong Kong?
Yes, madam. I'm still in Philippines.
So what is your job from since 2014 when you came back to the Philippines? What did you do up to the present?
Okay. When I come into Philippines, I fixed the problems, and then after that, I decided to work again in the hospital since in 2019.
Okay, so 2019 until now, right?
Yes, madam.
So what is your occupation? Is still the same? You are a nursing aide?
Yes, madam. Yes, now I assign in the emergency room.
So you are working there for almost 3 years now, right? 4 years,
Madam.
three,
Yes,
three.
3.
Okay. So you are assigned where? In
And
emergency. So
yes,
what is
madam.
your duty? What is your job? What is your task in the hospital?
Okay, just now for in an emergency, I help them to assist the patients when they come. I take the vital signs, and then I help to my superior, like a nurse, to assess if there is an emergency, like preparing the instrument, especially if the worst things.
Yeah.
Yeah.
Do you also help, for example, for wounded patient? Do you also help assist them in
Yes.
dressing the wounds?
Yes, that is my
That's your
rules.
duty. One is your duty also. Okay,
Yes.
so how much do you earn a month?
Oh, it is 10,000
So
or
why do,
sometimes.
okay, so why do you still have to decided to work abroad? Why do you still want to go to work in Hong Kong?
Honest now, I decided to work again as a domestic helper in Hong Kong because to the needs of my family and to the future, of course, my daughter.
Okay, so it means if in case you have employer in Hong Kong, you are allowed to resign from the job. How long it takes for you to leave your job? How long?
Uh,
Do you give 1 month notice or you just
yes, madam, it's okay. It's okay.
they just leave you? They
Yes,
you can leave anytime.
yes, ma'am. I only send the resignations because I
Resignation letter.
yeah.
Okay, because you had been working in Hong Kong, that's already almost 8 years ago. So do you still remember how to cook the Chinese food?
Yes, madam.
Like
With
what? What Chinese food you know how to cook?
like fry fish, steamed egg and
Steamed
or
fish,
fish. Yes.
steamed
Uh,
fish.
yeah, fry the vegetable. The try like whole chicken, steamed whole chicken and soup. But not what is that called? A simple dish, ma'am.
Oh, the
But I
simple dishes. Okay,
don't.
okay, so are you willing to, for example, if the day off is not on Sunday, are you willing to take any day any day, the regular day off or day off on weekdays? Are you
I
willing to accept? You
yes, madam. It's
you accept. And are you willing to work with other worker? For example, if employer has another helper, are you willing to work with another with another worker in the house?
I think so frankly, I don't like.
You don't like, so you want to work alone,
Yeah, yeah,
but
I
you accept
yes,
holidays on weekdays. Okay.
yes, ma'am.
Okay, thank you.